Our niche services offered in GCC by our group of hospital. In Aster Hospital Al Manpur, we have YAG laser capsulectomy and TAVI TAVR. In AHQ, Aster Hospital Al Kisis, we offer heart failure clinic sleep apnea. Aster Sanad Hospital, we offer heart failure clinic, pain management clinic. Aster Royal Al Rafa Hospital, we offer third space endoscopy and heart failure clinic. And Aster Al Rafa Hospital, Sohar, we offer foot and ankle clinic and sports injury clinic. Medcare Hospital, we offer proctology, snoring treatment, pain management clinic as a niche services. And Medcare Orthopedic and Spine Hospital, we offer arm and hand reconstruction, microsurgery center, PELD, plates group session, MPRC, and posture clinic. And Medcare Women and Children, we offer pain management clinic. Medcare Royal Super Speciality Hospital, we offer gene therapy, SMA, and DMD. My Aster TAVI consultation, we have across 7 Emirates, 50 specialists, over 700 doctors online. We do over 10,000 plus teleconsultation every year. It is fully integrated one, and we provide continuum of care with a lab, pharmacy, and home care services.
So this is a patient. You can see this patient has a very rare condition too called Bardet-Biedl syndrome. There are two, she and her sister, the same body habitus. This patient they all stayed at home, they were homeschooled. They have other conditions, very poor sight, hypertension, obesity, extra digits. You can see that she has been walking. The only way they can walk is just walking on their knees, moving around. They can't go to school, they are so heavy. So somebody saw them somewhere, a doctor saw them and told them to come to the hospital. And we were able to do something. I had to ask, because their limbs were so massive. I had to write to my friends in the US to help me with rings that will help us to correct that deformity, if they oblige. We were able to do that surgery for both of them, sisters. And this is what they achieved at the end of the day. They're able to stand and walk. Now they attend normal school. They have friends now, and they're able to live their lives the way they should. And so that's how both of them, how they came, he and her sister. So public enlightenment and education is very important so that patients can present early.
I'll start with some cases that I treated for the last few months. I'll impose also the idea of how the advanced practice will be. This is one patient came to me. He's 95 years old. He came with a left knee pain. The pain was for last 2 years, despite taking injections and medicine. The patient had a history of donation of kidney, and he had a history of subtotal meniscectomy of lateral meniscus 20 years ago, which was done in open technique. So we can go to the history. When we started with the meniscus surgery about 30 to 20 years ago, the main practice was to do with open technique. We're thinking if we have a damage to the meniscus, the best way is to remove it. Okay. In addition to that, many of previous thought that the meniscus, especially lateral meniscus, something is not important for the knee. So once any patients come with knee locking because of the meniscus, we go and do a small.
This is just to show it's traumatic EDH. Young alcoholic, he had presented with a history of slip and fall, and presented with a deteriorating GCS, right side pupil was dilated, so urgent evacuation helped him survive. This is chronic subdural, one of the common conditions, elderly gentlemen with history of cardiac issues on anticoagulants, presented with left-sided chronic subdural, we evacuated with burr holes, frontoparietal burr holes. These are the spontaneous cervellar hematomas, like hypertensive. Just as the doctor was telling, this is also one of the hypertensive emergencies. Just they do present just similar to the aneurysm bleeds. Initially, the patient had presented, and I couldn't mention show the initial CT that was showing around 1 to 2 centimeter of this one with a good GCS. Only thing was he was complaining of a headache.
This patient has several hemorrhage. Of course, if the patient has clinical feature to suggest a rupture aneurysm SAH and the CT is clean, then the thing to do is okay, go to the next level. Can you do a lumbar puncture? Get some CSF and confirm truly if there will be a bleed. What we are expecting, some xanthochromia, to say that yes, even though the CT appears to be normal, there are evidence to say that this patient must have bled before. And of course, to confirm that, you need to do a form of an angiogram. An angiogram is a vessel study. Since an aneurysm is primarily a vascular lesion, then you need to outline the vessel to see truly if they are aneurysm, how many there are, and of course describe the geometry, because these are all having implications for what you need to do for them as treatment. Gold standard CTA is CT angiogram. So the angiogram using the CT.
The weapon is filled up with expatriates. There must be something good happening, and I'm sure you have a good think about it. The challenges have been thrown at you. You heard what Dr. Omeka said when he showed you the beautiful pictures of things he has done, and he also ended by saying we need a lot of support.